Introduction. Floods have significant medical implications, both immediate and long-term, impacting physical and mental health. Immediate effects include drowning, injuries, and exacerbation of existing conditions like asthma. Midterm consequences involve infected wounds, complications from injuries, and increased risk of infectious diseases. Long-term effects can include chronic diseases, disabilities, and mental health issues, such as depression and PTSD. Flooding is one of the most devastating natural disasters globally, especially in low and middle-income countries. It occurs when water overflows onto land that is usually dry, often as a result of heavy rainfall, river overflow, dam breaks, or storm surges. While the damage to infrastructure is obvious, the public health consequences are often underestimated, but can be long-lasting and widespread. General effects of flooding. 1. Destruction of property and infrastructure. Roads, bridges, homes, schools, and hospitals can be severely damaged. Power outages and communication breakdowns may follow. 2. Displacement of populations. People are often forced to evacuate to overcrowded shelters. Loss of shelter can lead to exposure, especially in vulnerable groups like children and the elderly. Vulnerable populations. Pregnant women, children, the elderly, and people with disabilities are disproportionately affected by floods and their health consequences. 3. Disruption of essential services. Water supply, sewage systems, waste management, and food distribution networks are often compromised. 4. Economic loss. Agriculture, trade, and local businesses suffer due to destruction of assets and supply chains. Long-term poverty and food insecurity may follow. Health implications of flooding. Flooding poses both immediate and long-term health risks, which can be grouped into several categories. 1. Infectious diseases. Waterborne diseases, cholera, typhoid, hepatitis A, and dysentery due to contaminated water sources. Vector-borne diseases. Increase in mosquito breeding grounds leads to outbreaks of malaria, dengue fever, and yellow fever. Leptospirosis, spread through contact with flood, water contaminated by animal urine. Skin infections, from prolonged exposure to dirty water. Animal bites and stings, snakes, insects, and other animals may be displaced and become more aggressive. 2. Non-infectious health risks. Injuries, drowning, cuts, fractures, and electric shocks from submerged power lines. Respiratory issues, due to exposure to cold, damp conditions or mold growth in water-damaged homes. Mental health disorders, PTSD, depression, anxiety, and grief from loss of loved ones, property, or livelihood. 3. Nutrition and food security. Crop destruction and disruption of food supply chains lead to malnutrition, especially among children. Unsafe food storage can cause foodborne illnesses. 4. Disruption of healthcare services. Damaged hospitals and blocked roads delay emergency care. Outbreak response becomes difficult due to logistical challenges. Prevention of flooding and health consequences. 1. Environmental and urban planning. Enforce strict zoning laws to prevent construction in flood-prone areas. Build and maintain proper drainage systems, levees, and retention ponds. Promote reforestation and watershed management to reduce runoff. 2. Early warning and preparedness. Develop and disseminate flood forecasting and warning systems using mobile alerts, radio, and community networks. Create community emergency plans, including designated shelters and evacuation routes. 3. Public health interventions. Vaccinate populations against common flood-related diseases, for example, cholera, hepatitis A, tetanus. Stockpile essential medicines and water purification supplies. Educate the public on hygiene practices during floods, for example, hand washing, boiling water. How can infections be prevented after floods? It is critical that the affected communities have access to safe drinking water, uninterrupted safe water supply, safe wastewater disposal, and solid waste handling are key to preventing large outbreaks of waterborne disease. Health education is an important preventive measure. Messaging should focus on safe water, hand hygiene, and food safety. Water can be made safe for drinking and cooking by boiling it for a minute in a clean container. Another way is to mix a teaspoon of household bleach, containing 5% chlorine, into 20 to 25 liters of water and leave it to stand for at least 30 minutes before use. It's important to wash hands with soap and safe water before, during, and after preparing food, and before and after eating. Also wash hands before and after caring for a sick person. after using the toilet and after cleaning up a child. The World Health Organization's 5 keys to safer food are: keep clean, separate raw and cooked, cook thoroughly, keep food at safe temperatures, and use safe water and raw materials. Control measures and workable solutions. During floods, distribute clean drinking water and hygiene kits to affected communities. Set up mobile clinics and temporary health facilities in displaced populations. Isolate and manage outbreaks early using rapid diagnostic tools and trained teams. Disinfect and manage flood shelters with regular sanitation checks. After floods, conduct environmental cleanup, remove stagnant water, debris, waste. Repair damaged infrastructure quickly, focusing on water and health facilities. Provide psychosocial support and trauma counseling to flood victims. Monitor health trends and continue disease surveillance for emerging threats. Summary. Flooding is a powerful and often recurrent natural hazard with vast health, economic, and social impacts. The public health implications range from communicable diseases to long-term mental health burdens. While the environmental and infrastructural effects are immediate, the health consequences can be prolonged and deadly if not swiftly addressed. Prevention strategies should focus on long-term planning, community preparedness, and environmental protection. Conclusion: floods are preventable and manageable disasters with proper foresight, planning, and coordination. A strong integration of public health systems, community education, and resilient infrastructure is key to reducing the impact. Governments, health agencies, and individuals all have a role in adopting proactive, scalable solutions. Without timely interventions, the cost of inaction can be measured not just in damages, but in human lives. Measurable action plan. Establish flood risk maps and restrict housing in high-risk zones. Launch yearly flood drills and health education campaigns in vulnerable areas. Ensure health centers are flood resilient and stocked with emergency supplies. Train local health workers on flood response and disease outbreak management. If you find this video helpful, like, subscribe, or follow My Health by Dr. J for more important health videos.